Dr. Sullivan, Dr. Foster, Surgeon General Murthy, and to my colleagues, the former Surgeons General. I feel a little bit like the guy in the church where I grew up back home. He would get up at the end of service on Sunday and say, well, just about everything that needs to be said has been said. Then he would clear his throat and say, but not everybody has said it. Well, I know you want to get to the question and answer session, so I'm going to make a real effort to be brief. I have really appreciated the comments of the former Surgeons General and the outstanding presentation of Surgeon General Murthy. Let's give him another hand. So I just want to briefly review the areas that I tried to deal with as Surgeon General. And I must say they were greatly influenced by the experience I had had, especially as director of the CDC. And as you remember that time when we had the president to apologize for Tuskegee and reviewing that whole history, the efforts to eradicate polio, including immunizing 100 million children in India in 1 week and learning a lot about teamwork, but also working with an acting Surgeon General in bringing forth a report on physical activity and really realizing how few Americans were physically active on a regular basis. In fact, we found that the number of schools requiring physical education K through 12 had decreased from about 50% to 29% when we released a report on physical activity in 1996. And that was Dr. Audrey Manley, who as acting Surgeon General released that report. So when I became Surgeon General, there were several areas that we felt should be priority and resulted in reports from the Office of the Surgeon General. Now, tobacco has been a priority for all of us. That's sort of how the Surgeon General report started. So my first report was on tobacco, smoking, and minorities. I did another report on women and smoking, and one on strategies for reducing tobacco use that played a role in the World Health Organization's summit on global smoking. Mental health was a major priority of mine, and that had started in a way when I was director of the CDC and even earlier, because I was concerned that there was no center on mental health at the CDC, given all of the mental health problems with which we were dealing. But not only that, I don't know if you remember, but in 1999, we had the Columbine shooting. And that was the first high-profile shooting in the country where 2 students came to school with guns, killed 12 other students, a teacher, and then killed themselves. And I've often said that the only report that I did that was requested by the White House and the Congress was a report on youth violence prevention. Now, the bad news is that when something like that happens, Americans get up in arms, but it doesn't last. We don't follow through and change policies, make it more difficult for people to get guns. We just rise up after the occurrence, and then when it blows over, we go back to business as usual. Whether it means being more attentive to mental health needs of people and making it easier to identify people who need mental health interventions, we have not responded. I'm really happy to hear that Surgeon General Murthy is going to make mental health a priority. But I'd be happy to respond to questions about our work in mental health and our work in obesity and oral health. This is the 15th anniversary of the Surgeon General's report on oral health. And I was thinking as I saw Renee Jenkins, because there had never been a Surgeon General's report on oral health. And in our report, what we tried to say, just as we said that in mental health, the brain is a part of the body and you can't completely evaluate a patient without evaluating their mental health, we tried to point out that oral health was critical to overall health and well-being. And with the help of the pediatricians, especially the Academy of Pediatrics, to really urge physicians to become more involved with oral health as a sort of a window to the rest of the body. I've served as both Surgeon General and Assistant Secretary for Health, so I had the responsibility of releasing Healthy People 2010 on January of 2000. And it was in that report that we put forth the goal of eliminating, not just reducing, but eliminating disparities in health among different racial and ethnic groups. And it is that goal that we continue to struggle with. And finally, after leaving the Office of the Surgeon General, I was asked to serve on the WHO Commission on Social Determinants of Health. And what's so important, I think, and the Affordable Care Act does this quite well, even though Congress has not funded it, is that we have to incorporate the social determinants of health in everything that we try to do. And so I think asking the question as to whether, in fact, a patient can walk in his or her community is a critical question. So I hope that that outline at least helps in terms of any questions or comments you may want to have in those areas. Thank you.